Hello, how are you doing? I'm doing good, thank you. So I see here that you signed up to come in for a cranial nerve exam. Okay, fine. I'm just going to take down your particulars and then we'll get into the exam, okay? Sure. May I have your name? Surname? Okay. And what is your date of birth? Okay. And when was your last visit here? Okay. All right. And what are your concerns? Like, what brought you here today? Was it something with your eyes, your sense of smell, any pain, discomfort in the body? Mm-hmm. Mm. All right. I'll put this down and then I'll just start by examining you, okay? So before I start touching and examining you, I'm going to sanitize my hands with a bit of sanitizer, alright? Other side. Awesomeness. Okay, I'm gonna start by just checking your breathing, okay? So I need some slow, deep breaths from you. I've got my Bluetooth stethoscope here. Remember, slow and deep breaths, okay? Let's go. Breathe in. And out. One more time. Breathe in. And out. I'm gonna just go around your back, okay? Breathe in. And out. Okay. Your breathing is fine. So now I'm just gonna check your face. Okay. Just apply light pressure on your cheeks, alright? And just tell me if you feel any discomfort, like a slight pain or just stuffiness, anything like that. Okay. And your cheeks, your jaw. Okay. Okay. Other side. Yeah. And your temples. Okay. 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 All right. And how does your neck feel? I'm just running my hand down. Gonna use both my thumbs and run it just along the sides, okay? Okay. It does feel a bit stiff, but that's nothing too tense. A light massage before bed can always help with that. Okay. All right. So your face is good, temples all right, and it's just the area between the neck and shoulder. Okay, I'll add that down to my notes. Okay, continuing from the light pressure on your face, phase 1 of the nerve exam will be checking the muscles and nerves in your face. I'm just looking for the ability to move, hold an expression, and reaction. That lets me know everything is still working good, okay? Shh. Are you okay? All right. Shh. 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 Okay. Shh. Shh. Okay. One more. Shh. 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 All right. Now, reaction time is good, so you're healthy. Now, I just need you to give me a big smile. Show me all 32 teeth. Awesome. Awesome. Just hold it for me. Alright. Now give me a frown, the brows. Can you go a bit deeper? Okay. Can you wriggle them? You can only raise one. It's okay. Alright. Your facial muscles look like they're functioning well. Thumbs up for you. Now I will check your sense of taste, okay? I've got 3 different flavors. I want you to close your eyes and I'll just feed it to you and you let me know whether it's salty, sour, bitter or sweet, okay? Okay. Here's flavor number 1, okay? How's that? Yes, indeed. It is sour. It's a sour worm. Okay. Number 2, just stick out your tongue and I'll bring the flavor to the tip, okay? Close your eye. Close your eyes. Okay. Salty. Yep. That's just regular table salt. And the last one, I'll break you off a piece. Yeah, it is slightly bitter. This is dark chocolate. Okay, your taste buds are working just fine. Okay, just have a sip of water and then I will look at the condition of your mouth, particularly the back of your throat, okay? Okay, here's the straw, take a sip. Awesome. Alright, I need you to open wide, okay? And stick your tongue all the way out. Okay. Okay. open wide. Okay. Everything looks alright back there. There's no inflammation, no stones, calcium stones in the tonsils, so you're healthy. Now we're going to check your sense of smell. Alright, I've got 3 essential oils that I'm going to dab onto a cotton pad for you, and then you just tell me what the name is, even if you don't get it right, but whatever notes you get a whiff of. Okay, so this is scent number 1. Okay, let me know. Yes, this is rose. You're spot on with that one. Okay, scent number 2. Want to try again? Yes, this is orange, but particularly orange peel. Alright, good job. And the last one, third and final scent. I think this one should be fairly easy. Exactly, peppermint. I'm sure you smelled it when I opened it. Yeah, it's quite a potent one. Alright, you got all 3 right, so I think we don't have to worry about your nose, okay? Now we're going to check your hearing, okay? I'm going to make a noise closer to your ear and then further away, and you just tell me far or near, okay? But I'll need you to close your eyes first. Close your eyes. Thank you. Let's go. Yes, that is near. Okay. Yes, that's further away. Again. That was also far. Yes, that was near. Okay, awesome. Let's put this away. And now I'm going to whisper into your ears, okay? And I just want you to repeat what I've said. Alright? I'll say one word, you just relay it, okay? Barbecue. Okay? Island. Okay. NASCAR. Pirate. Good. I think you've got these ones down pack. Now, just tell me left or right ear, okay? Tell me which side the sound is coming from. Okay. Okay. All right. Good job. Once again, your hearing is A1. So now I'm going to check your eyesight, okay? Just gonna show you a few colors, or a few colored items rather, and you tell me what color it is. Okay. Yes, it's a green nail file. Correct. It's a red and gray mini stapler. I like miniature things. Exactly. It's a yellow box of toffee. Do you want to get detailed? Exactly. With red and purple writing. Awesome. Optical nerves working good. Okay. Now I'm gonna have 2 mini gums in my hand. Okay. And I want you to focus on one. Okay. I need you to focus your eyes on this one. Even as I'm moving around, focus on the one I specified, okay? Cool. Now this one. Cool. Amazing. Now, I have both my hands upright, and I need you to focus on the one that moves out of frame, okay? Nice. Nice. Okay, I caught you there with the last one. I moved both hands. But all those 2 tests were to test your peripheral vision. Okay, now I'm going to assess your eye dilation. Okay, I'm going to bring out a flashlight, focus on my finger, and then I will bring in the flashlight. Focus. Okay, again. Okay. Okay, now the other eye. Now this time I want you to tell me where the light is coming from, alright? But keep your eyes on my finger, okay? Let's go. Good job. Okay, lovely. Okay. Last one. Okay, can we just do this eye one more time? Okay. Okay. Okay, both your eyes are dilating well. I just think the one dilates a bit more than the other, but I think it's nothing to be too concerned about as of yet, because the other test showed your vision to be good. You can identify color, your peripheral as well. Your optical nerves are working just right. I think it's just a bit of a delay on the one eye, but don't worry too much, okay? About your one eye dilating more than the other, that is a condition called anisocoria, okay? And it's nothing to worry about, just like I said, but the causes are usually any trauma to the head, you know, any optical injuries, or just any vigorous activity that happens within the head or eye area. Have you experienced any of that? Okay, okay. That is understandable, and I just want to assure you that you are okay once again, and it is not a condition to worry too much about. Okay? Checking back again on my notes, your eyes are functioning well, like I had said. Your peripheral is working well, and you can identify color. Alright. Once again, your hearing was A1. You could tell me which side the sounds came from and whether it was far or near, and you were able to repeat each word I said to you. So, thumbs up. You were able to identify each of the scents I presented to you, even the flavors that we tasted, right? Yes. And your facial muscles are doing great. I know earlier we also pointed out some tension between the neck and shoulder, so I will prescribe you some aromatherapy oils, okay, that will help ease the muscle and will be used on you whenever you get a shoulder massage. Once a week before bed should be just fine until you feel that you're more flexible and relaxed, and then you can stop. Okay? Awesome. We've come to the end of your exam. Thank you so much for being here. I hope you are relaxed, your concerns have been addressed, and you heal your shoulders. Okay? Once again, thank you for coming, and see you next time.